Right, let's talk about Medicaid. For millions of Americans, it is, quite literally, a lifeline. It's the difference between getting life-saving treatment or getting sicker. And when politicians start cutting Medicaid, they're not just cutting numbers, they're slamming doors in the faces of real people. Think about who relies on Medicaid. Nearly 1 in 5 Americans, including millions of children, elderly individuals in nursing homes, people with disabilities, and low-income working adults. Medicaid is supposed to be the safety net, but with every cut, that net gets more holes, and people are falling through. Politicians use language like fiscal responsibility and streamlining services, but in reality, it means people losing essential care. These aren't just anecdotes, they are the lived experiences of our fellow citizens. Today is May 26, 2025, and this issue is as urgent as ever. Let's meet Sarah. She's a single mom, working 2 part-time jobs, doing everything for her 7-year-old son, Leo.
Leo has severe asthma, requiring daily medication and a specialized nebulizer.
Medicaid ensured Leo got the care he needed, but then came the letter.
The letter said Leo's nebulizer solution was no longer covered. I had to pay out of pocket, which was impossible.
Panic set in. Sarah spent hours on the phone, navigating a bureaucratic nightmare.
I was fighting a faceless system for my child's breath. It was exhausting and infuriating.
Sarah started a local petition, shared her story, contacted news outlets, and organized a protest.
I refused to give up. This was a direct threat to my son's life.
Sarah is still fighting, not just for Leo, but for all children affected by these cuts. Her resilience is a testament to a mother's love. It's a fight she should never have had to wage. Now let's talk about Joe. Sergeant Joe served 3 tours in Afghanistan and came home with PTSD.
Medicaid gave me access to crucial therapy when VA benefits were delayed.
Then the state announced Medicaid cuts affecting Joe's therapy.
I felt betrayed. I fought for my country, only to fight my own government for health care.
This was about his sanity and stability. Joe started a support group for veterans and spoke out at town hall meetings.
I turned my struggle into a crusade to ensure veterans get the care they deserve.
Joe's new mission is to honor the promises made to veterans. His fight is for all Medicaid recipients. Joe's story is one of resilience and advocacy. He's determined to make a difference.
Meet baby Emma, born 3 months early, weighing just 2 pounds.
Her parents, Mark and Lisa, faced astronomical NICU costs.
Medicaid was our only hope to avoid financial ruin.
Then came news of proposed Medicaid cuts, adding to their terror.
The community rallied with fundraisers, but charity isn't a sustainable solution.
Emma's future and many others depend on policy decisions. Baby Emma continued her fight, unaware of the larger battles over her right to a healthy start. Medicaid isn't just for other people, it's deeply interwoven into our communities. When Medicaid is cut, it affects all of us. Many low-wage workers rely on Medicaid because their jobs don't offer health insurance. If they lose coverage, they delay care, leading to worse health outcomes and higher costs. Rural hospitals, often the largest employers, rely on Medicaid reimbursements. Cuts can force them to reduce services or close, creating healthcare deserts. How we treat Medicaid reflects our societal values. Do we believe healthcare is a right or a privilege? The people affected by these cuts are us. When the system fails them, it fails all of us. Politicians talk about savings, but what is the actual price? When you slash healthcare, costs reappear as larger problems. For children like Leo, inconsistent asthma medication leads to severe attacks and hospitalizations. For diabetics, lack of insulin leads to costly complications. Medicaid provides essential health coverage for nearly 40% of children. Cutting these services means missed diagnoses and untreated conditions. The moral cost is significant. Balancing budgets on the backs of vulnerable populations is a betrayal of our responsibility. These cuts are deliberate policy choices. The savings are an illusion, the losses are real. After hearing these stories, you might be feeling angry or helpless. Don't let that feeling win. These stories are a call to action. Get informed about Medicaid in your state. Speak up. Call your elected officials, send emails, attend town hall meetings, share these stories on social media. This isn't a partisan issue, it's about basic human decency. Demand a system where healthcare is a right for everyone. The lives of people like Sarah, Leo, Joe, and Emma depend on it. Your voice can be their lifeline. Let's use it.